It would be in a couple of years, actually.
You want H91?
Actually, it can go either one you want to do first.
891?
Okay.
Okay.
891. Both of the bills that we're dealing with now have to do with bills that we passed tremendously overwhelmingly, pro-life bills in 2016. Unfortunately, both of them have been held up in court. So starting with 891, we passed that bill in 2016, and that bill prohibits public funding for entities that perform abortions or leases its facilities to abortion providers. That law has been held up in federal court because of a lawsuit filed by a North Louisiana abortion clinic. The original challenge was somewhat technical in nature since it referenced, quote, contracting. This bill amends out the word contract, makes it clear that the prohibition on public funding shall not be construed to prohibit provisions of public protection like fire or police or public utilities or other such services as claimed by the abortion clinic when they brought the lawsuit. This bill simply clears that up. This bill's intention was and still is not to allow those who perform abortions or share facilities with abortion providers to receive Medicaid funding. We worked with several experts on these issues, including the Solicitor General Liz Murrell here. We've had Dorinda Bordley helping with us as well, and Mrs. Murrell and I will be glad to answer any questions you have.
Ms. Merle, did you want to add anything to the testimony?
No, this bill specifically is just intended to bring some clarity to the law. One of the allegations that was made in the lawsuit was that this could potentially be used to cut off water from local water service. So we just wanted to put some more specific language in the bill that would bring some clarity and potentially help us resolve the litigation.
Very good. We have cards of support, and I'll read those in. Rob Tasman, Charles Carpenter, Ben Clapper, and Christy Cross. And when you get a chance, Ms. Merle, just fill out a card for information. You did? Okay. We do have, did you want to ask a question to the panel? We do have some cards in opposition, and one of the opponents would like to speak. Michelle Ernberg. So, and we also have Ms. Megan Snyder in opposition. So we'll allow the opposition an opportunity to give us their point of view.
Thank you.
Welcome, and please just state your name.
Mr. Chairman and members of the committee, my name is Michelle Ehrenberg. I'm the co-founder and executive director of Lift Louisiana, a reproductive rights organization. And I do appreciate the opportunity to appear before you today to express my opposition to HB 891. This bill is an attack specifically on Planned Parenthood, although they're not named in the bill. And it's an attempt to restrict the services that Planned Parenthood can provide to its patients, of which I am one. And I'm not alone. 1 in 5 women in America has sought care from Planned Parenthood health centers. We seek services there because we know that they provide high-quality health care and information with compassion and a deep commitment to women's health, well-being, and dignity. Planned Parenthood health centers also provide preventative services that other safety net family planning providers simply do not offer. In Louisiana, Planned Parenthood provides reproductive health services to Medicaid patients, and it is in court challenging the 2016 law that Representative Hoffman alluded to that would force them to stop serving Medicaid patients if they were to obtain an abortion license. HB 891 inserts a new provision, actually, that is intended to make it even more difficult for Planned Parenthood to provide abortions by prohibiting the health center facility from obtaining a license to provide abortions in the first place if it serves any Medicaid patients. It's clear that this legislature is attempting to invent new barriers to prevent the provision of abortion by Planned Parenthood specifically. But this bill would also make it impossible for other clinics that provide abortions to ever be able to provide other reproductive healthcare services to Medicaid patients, which further restricts the kind of care that low-income women can receive and where they can receive that care. Louisiana ranks among the worst states in the country for abortion access, and it is third poorest in the nation. Women and girls in our state lack access to sexual health information and contraceptive resources that they need to prevent an unwanted pregnancy in the first place. More than half of pregnancies in the state are unplanned. So the need for reproductive health care, including safe and legal abortion, is dire. There are only 3 remaining health centers that provide safe legal abortion in the entire state to serve nearly 1 million women of reproductive age. And you may think that that's okay, even desirable, but it is not, because many women seeking abortion are already experiencing economic hardship. Being denied a wanted abortion results in economic insecurity for women and their families, increasing the likelihood that women will become unemployed or fall into poverty. So that's why I'm here to state my support of Planned Parenthood's ability to have a license to provide abortions and to be able to continue to provide comprehensive health care services to Medicaid patients. That's also why I'm opposed to this law, because I believe it would deny Planned Parenthood an abortion license simply for providing health care to low-income women. Thank you so much for the opportunity to testify today on behalf of the patients like myself who rely on Planned Parenthood for essential, high-quality health care every year, as well as the doctors and the clinicians who want nothing more than to continue to provide essential health services to women, men, and young people in our state.
So are you saying that your concerns are if say, a female is getting a mammogram in the same facility as a facility that supplies abortions, that those Medicaid services, that funding would be totally denied? Is that your thoughts?
Yeah, that's essentially what the bill would do. If Planned Parenthood, well, it would prohibit Planned Parenthood from being able to have a license to provide abortions and at the same time provide other healthcare services to Medicaid patients.
Okay. We have some questions by the panel. Senator Barrow?
I'm just trying to make sure I understand this correctly. So if a young lady shows up and she wants to have a mammogram or a pap smear or something of that sort, and she's on Medicaid, if this bill is enacted, you're saying that she will not be able to receive those services, or you guys will not be paid for it?
So I'm not an employee of Planned Parenthood, just for the record. But the way that I understand the intention of the bill is that that Planned Parenthood would no longer be able to be reimbursed from Medicaid for those health care services.
Someone here from the department, or did they leave?
Anyone from LDH here? Anybody?
So it's essentially, the way I understand the bill, and maybe the bill's author can further explain, but that it basically is creating, a Faustian choice for Planned Parenthood, either to continue to provide the services they're currently providing to low-income women in the community and be able to be reimbursed through the Medicaid program, or get a license to provide abortions. And my position is that that should not be a choice that a health center like Planned Parenthood has to
You want
make.
to speak to that?
I think I can speak a little bit to the original. I mean, the original law was passed in 2016.
Mm-hmm.
That bill has been attacked in federal court and is currently in litigation by a number of clinics. There's a new lawsuit that's also been filed by Planned Parenthood that also challenges the constitutionality of HB 606, which was the original restriction on funding. There's some language that was in that bill that is that we've had some discussions with in the litigation in the original challenge filed by the June Medical Group, and we thought that this language would help clarify some of the issues that have arisen in that litigation. The original intent of the bill, as I understand it, and I did not have any involvement with the actual passage of that bill, but it's a policy I think that was overwhelmingly supported by the legislature, was to restrict funding to entities that share their facilities with, through affiliation agreements and other agreements like that, share their facilities with abortion providers. And so it was intended to separate public funding from private funding in those facilities. So the net effect of that is that if Planned Parenthood is a Medicaid provider in New Orleans right now, and in Baton Rouge, I believe. And so if they choose to have an affiliation agreement where they will begin providing abortions in New Orleans, then this law would affect them.
An amendment to take it out, take
Thank you, Ms. Merle. As Senator Barrow's working on her potential amendment, I'm going to turn it over to Senator Clater and then go back to you, Senator Barrow. Senator Clater?
I think we're all kind of focusing on the same thing in that, which, well, maybe not, but what are the other healthcare services that Planned Parenthood provides? I don't know what those are.
Okay, well, it's a
Because
good-
you spoke about it. What are they, and who do they provide them to?
well, and again, I don't work for Planned Parenthood, so I'll do the best that I can being a patient and a supporter of the services that they provide. But Planned Parenthood provides pap smears, they provide cervical cancer screenings, breast exams for early detection of potential breast cancer. They provide contraceptive services. They provide pregnancy management care and referral services. And currently, they're not providing abortions in Louisiana at either of their two facilities. So, you know, the overwhelming majority, you know, up to 100% of the services that they're providing are healthcare services, not just women's healthcare services, but also STI testing and screening and treatment.
All right, and you may or may not know the answer to this, but are they alternative providers out there as well?
So it's a good question. Last year, actually, the state of Louisiana provided, they did a 2017 reproductive health assessment report. And I'm happy to follow up with you guys with a link to that report. But in it, it actually shows that that less than half of the federally qualified health centers in the state that do provide reproductive health care are providing more than one type of contraceptive service. And almost none of them provide same-day contraception for things like the IUD, which is a long-acting reversible contraception. So Planned Parenthood is actually filling a need and a gap in healthcare services in the community that would not be able to be absorbed by the existing healthcare facilities.
All right, thank you, Mr. Chairman.
Thank you, Senator Clater. Senator Luna? Oh, I'm sorry. Yes, now you're on.
All right, if this doesn't, maybe Ms. Merle, you need to come back to the table. You can probably answer some of these questions. If this doesn't affect Planned Parenthood, who does it affect?
Well, I don't think I said it didn't affect them. I think if they fall under the purview of the law, then it could affect them.
Okay,
but
well, my appreciation from the earlier testimony is that they don't perform abortions.
That's correct.
Who is this bill aimed to affect?
It's intended to prevent affiliation agreements that would allow the sharing essentially and the subsidizing of abortion through public funds. So
Okay.
that's the purpose of the bill, the original bill. This bill is a clarification bill that is a result of, I think, multiple people working to try and make it more clear and improve it based on some of the conversations we've had resulting from the litigation.
Ma'am, do you know of any clinics currently that this bill would affect in Louisiana?
Well, there are 3 existing abortion clinics, and I don't think any of them are Medicaid providers at this point. So this really is, you know, a law in search of a problem that doesn't currently exist.
So you don't know of anybody it would affect currently?
Currently, yes.
Okay. Do either of you know of any cases that have been tried in the state or in the federal level that's dealt with this specific issue?
Senator Luna, there is some litigation pending around the country. There's none in this state other than the cases that I cited to. There are 2 cases right now related to the original bill, HB 606, that was
Those are-
filed
those are
that was
currently
approved
pending?
in 2016. Those are currently pending cases.
I guess
and
I'm more interested in, have there been any cases decided on this issue?
There have been some other cases, and I don't have them in front of me to cite. I'm happy to follow up with you. There have been cases in other states where laws have been passed to, restrict Planned Parenthood from being part of Medicaid programs or restrict their ability to serve Medicaid patients. And I believe that the result of a lot of that litigation is that those laws have been struck down.
Are you familiar with any
And
cases
I
like
would
that, Ms. Merle?
disagree. I think there are cases that have allowed the state to not fund abortion through the Medicaid program. Both federal, those are Supreme Court level and Fifth Circuit cases. So we can restrict the funding of abortion with the Medicaid program. These are laws that are, some of these laws have been challenged in different ways, and these laws aren't all written the same way. This law that we have before you is not written the way any of the other laws that I've ever seen that have been challenged. We worked on this language specifically because of some issues that arose in our specific litigation. So I don't think that it's the same.
Let me tell you my concerns and what I'm getting at here. You know, we've been litigating a lot of these bills that we've been passing, and we've been losing a lot of these bills, and we've spent millions, literally millions of dollars trying to defend a lot of these unconstitutional bills. I don't want to pass a law that has already been held unconstitutional somewhere. So, and I'm not talking about just because there's a comma in this one. I'm talking about substantively. Is there anything where this has already been struck down in any courts that you're aware of, substantially similar statutes?
Not substantially similar. I mean, ours is very unique, I think, but
tell me how
I
it's
would
unique.
also say that I think that your laws are presumed to be constitutional when you pass them, and it doesn't. I mean, I'm involved in a number of cases right now defending laws that you passed, and on this subject, they will always be challenged. So it's a policy decision about whether you're going to pass the laws or
How
not.
is
They're
this one
going to be
unique?
challenged. I believe that they are constitutional, and that's why we go out and defend them.
That's not what I'm asking at
Well,
all.
I
How
understand,
is
but
this
your
one?
premise was passing
Hey,
unconstitutional laws.
Let's just really try to stick with answering my questions. We've been here a long time talking about the bills today. I want to know, how is this one substantially different?
Because we drafted it, we worked on drafting it uniquely to respond to pending litigation and try and address some concerns that were raised by the plaintiffs in that litigation.
All right. And you feel comfortable that this is not an issue that's already been decided one way or the other?
Correct.
Okay, thank you.
Thank you very much. Senator Barrow?
I don't think I'm ready, Mr. Chairman. I'm still trying to get clarity on the bill and the issue as it relates, because I find that if I submit this amendment, it in essence really guts the bill, and that's not my intent. But I am concerned about the fact that I know that the services, not that I agree with the concept of who they are, but the services that they provide, I think, are much needed for many of the individuals in the community. And if that's going to restrict their ability, I think, to be reimbursed, and that creates, for me, a little of a challenge. So I'm not going to submit the amendment, but I'm just at a crossroad of trying to figure out how I could try to make this a little better.
I think to help just the kind of frame everything, I think the issue has been if there's an abortion clinic that provides other Medicaid services, the way the bill is written, that facility could not garner a provider license from LDH. And that's what the bill basically reads right now. So that's it's so noted. And Senator Clayton.
Can I say one more thing,
Yes.
Senator Mills? Thank you so much. So I guess what I would say to that is that I lost my train of thought. I'm
Okay.
sorry. Anyway,
Take your
thank
time.
you.
Senator Clayton's got the floor. Let me let Senator Clayton take over. Senator?
If everybody has had the opportunity to speak for and against, I think I have an understanding of it, and I appreciate the AG's office providing us with some background. I'd like to move that we report the bill favorably.
Okay, we have a motion by Senator Clayton to move HB 891 favorable.
I don't want to object, but I think I do have an amendment.
Senator Barrow, would you like the amendment now or on the floor?
Yeah, we have it.
Senator Clayton, you okay with an amendment prior to your motion?
I think that's the process. We have them in here if we wish, so that's
Okay, okay. Senator,
motion in advance.
sure. Vice Chairman Barrow, if you would like
Yes,
to.
so in concept, this is the amendment, and so what the amendment would do is on page 2, line 8 and 9, it will delete provides reimbursement medical assistance program services in the same physical facility as a licensed outpatient abortion facility. And then also on page 3, lines 23 and 24, which reads the same. So if I find that this does not do any harm to the bill, then we would like to offer this as an amendment.
So members, what the amendment basically does is makes other services reimbursable for Medicaid other than an abortion. That's the intent, right?
Yes. that's my
Okay.
intent.
Senator Clayton on the amendment.
I would ask that maybe the AG's office come if they could just, if they're in a position to offer an opinion on how that impacts the legislation.
Can I ask a question about what the amendment does? Because I was kind of,
What the amendment does, the way I read it, it basically would allow an abortion facility to provide other Medicaid services and garner a Medicaid provider license, but it would be just for the services that are not abortion related.
yeah.
So it would kind of hit that if they do offer all the other services, those services you could garner a provider permit and it would be reimbursable. That was the intent, huh,
Right, that's
Senator?
right,
That's
The-
the
the-
intent.
The whole purpose of this bill, though, in 2016, and still is, that if you do abortions, you cannot receive any kind of Medicaid funding, period. Now, if you don't do abortions, and Planned Parenthood does not do abortions in Louisiana, so right now, they can and do receive Medicaid funding. And they will continue to as long as they don't do abortions.
Give you the floor.
If they start to do abortions, and this law ever gets approved, and I think it will, then of course they would not. This is a pro-life bill. There's no question about that. But that's the purpose here. And there's plenty of places that you can get Medicaid coverage for the other services you're asking for, besides those who do abortions.
Well, I guess as I understood it, and as I was trying to read through it, it says if you perform abortions in the state, the A, B, and C, that actually takes up that part. I didn't think that taking that part out would actually harm the bill. Because it has on that, performs abortions in the state, provides facilities to another healthcare provider, entity, or organization for the purpose of performing abortions in the state, hires or retains another healthcare provider, entity, or organizations. So it just kind of goes through the whole litany.
Yeah,
So I thought that would not do any harm, but you think that it does.
And frankly, I'd have to get into it further and get some legal advice
Okay.
before I knew that it didn't
That's
do
what
it
I was trying to
any
get
harm.
to. I was trying to get further clarity.
Right.
So
Senator Clayton, you wanted to talk?
yeah.
I don't
Let's
wanna-
hear your thoughts, Senator, as an attorney. And
No,
we'll continue to listen.
I think it's a
Yeah, we need an
policy
attorney.
question, really. It's not an attorney question. And I think Representative Hoffman has summed it up and framed the issue, and it's my understanding that you oppose the amendment or don't willingly accept it, correct?
To start with, until I totally understand. Right. If it means that these people could do abortions and still get Medicaid services for other things they do, then yes, we would be opposed to that. We're trying to make
Yeah.
this a pro-life state.
Okay. I
think we're pretty pro-life.
Yeah. So, and that's
Continue
my
to be pro-life
interpretation
state.
as well, and I understand what the author's purpose of the bill is, and so therefore I'm going to have to object to the amendment.
Well, you don't have to object, Dan. I'm going to withdraw my amendment because certainly everybody know I'm pro-life, but I do not want to hinder individuals from being able to get services. So I would withdraw the amendment. I will try to work. I'll work
We'll
with you
talk
between here and the
between now
floor,
and the floor.
so we can have a better
Absolutely.
understanding, clarity.
Yes, ma'am. Thank
Okay.
you.
Thank you.
So Amendment 3180 has been withdrawn, and we do have an original motion. Senator Luna, did you want the floor? Okay, sure. And then Senator Chabert after.
Representative Hoffman, I'm not going to let you off either today. I've talked to your
Okay.
colleagues about this. You guys need to remember, pro-life means we have to take care of people after they're born, and many of these people can't take care of themselves. We need to fix the budget. Help us do that too. Thank
I
you.
agree with you.
Thank you, Senator. Senator Chabert.
And my comments are along the lines of Senator Luno's, but not with a fiscal tone. I mean, I got a 100% pro-life voting record. Y'all know I'm with y'all. I mean, that ain't even a point. But one of the biggest knocks that we have as advocates for life is that we forget about it after it's out of the womb. I get that. And this, to punitively penalize, and I'm for your bill, I'm going to vote for it. I
I
get
know,
that.
I know.
All right. But when you have an amendment like that that says that people that are providing care, all right, should not be reimbursed if they engage in something that we agree with. I mean, you penalizing somebody in the healthcare arena for the most Christian principle that there is, okay, helping people.
You make a very strong argument, and we haven't written that off. We will discuss that. But again, when this bill was written, there's plenty of other people who do the services you're talking about for Medicaid purposes that don't do abortions.
But in that circumstance, at that time, okay, access to care could be critical. It could be life or death, right?
Yes, sir.
And,
Okay.
and you know,
Well, we'll talk.
I'm with you, and I
Okay.
appreciate the vice chairman's willingness to withdraw the amendment and continue to talk with the author.
It'd be great.
Senator Clay? Thank you. Thank you, Senator Chabert. Senator Clater. Thank you.
Yeah, so I've been pro-life. I've gotten the pro-life award and those things, and it alienates me from some of my friends, but it's who I am, and we have different views. But I have to chime in with all of the rest of the folks here as far as let's not forget about these children once they come out of the womb. And I've tried very hard to do my share to respect life from conception to natural death. And as long as we're going to take this soapbox while we're in here, I think that extends all the way to the death penalty. And we've had this discussion, and I've been voted down on that if you really are pro-life and you believe it's a gift from God and that God gives it to us, it's not for us to take, then I think we ought to consider getting rid of the death penalty as it relates to a horrible waste of money when we talk about spending hundreds of millions of dollars to just kill maybe one person every couple of years, and those folks got to be volunteers. So we can do better on this, but we've not sugarcoated this one. We're penalizing people and denying some access here. That's absolutely true. That's part of what we're doing here, and we're doing it in the name of being pro-life. And let's go ahead and be pro-life all the way down the line as far as helping those once they're here amongst us and the least amongst us. So,
Well said, Senator Clater. Thank you. Senator Barrow?
Well, I was really contemplating whether or not I should say anything. I think it's really all been captured, and you know me,
I do.
Representative Hoffman, and all of you guys know that I'm pro-life, but
Okay.
access is real important. And I can tell you, since we have made many cuts, the ability to have access has become slimmer. And because the rates to physicians who used to or once did see many of these patients are not seeing them, that is a real big issue for me. I'm really concerned about access. And so I look forward to us continuing the conversation. I don't know, because I'm not trying to gut the bill. I'm not trying to take away the essence of what we are trying to achieve. But I do not want to limit or further restrict access to individuals who need it. And then you know what they do? They show up in the emergency room.
Right. Right.
Okay.
That's hard to argue. The bill, when it was written in 2016, the whole purpose was, let's don't do abortions. And, we want to provide services for you and get Medicaid funding for you. Just stop doing abortions. And actually, that has happened in many, many cases. And Planned Parenthood still does not do abortions in Louisiana and gets total funding for all the other work that they do in Louisiana. So,
Very good. We have a motion by Senator Clater to report HB 891 favorable. Is there any opposition? Seeing no opposition, HB 1 is reported favorable. I'm sorry, what is that? Oh, I'm sorry, 891. Excuse me. I guess I was thinking of the budget. The budget was, No. If we had done that, just us. Yeah, because we would know what to do with it.